So you're currently pregnant, but you want to get a chemical peel after you give birth, and you plan on breastfeeding. Is chemical peel or are chemical peels a good idea for you? Personally, I will say no. And the reason is because your skin is still going to be going through a lot of changes. And so let's say, for example, when you're pregnant, your estrogen levels are super high in order to sustain a pregnancy. So for a lot of people, they get this pregnancy glow, right? Their skin looks good, everything looks good. For some people, it's not the case. I was not the case. For me, I had the opposite. I had darkening of my skin. I had melasma, all of that. And so after you've had the baby, now your body is trying to go back to its original state. But during that period of breastfeeding, you're going to be going through something called I would call it a pseudo menopause. And what that means is that your estrogen now, it went from being super high to super low. Not low enough where like you're in menopause, but low enough where you're starting to see a lot of changes, not just in your skin, but in your body. So everything's dry, your skin's really dry and sensitive. You might develop melasma after having this baby, which is something that a lot of us deal with. And so during that breastfeeding period, at least for the first 3 months or first 3 to 6 months, your skin is still trying to get back to its regular state where you have surges of estrogen, testosterone, and progesterone for your menstrual cycle, okay? So because your skin is going through all of that, adding a wound to your face, which is what a chemical peel is. It's controlled injury to the skin with a specific outcome. It could be smoother skin, it could be improvement in the texture, but it's still an injury to the skin. So injuring your skin with that in mind is not necessarily the best thing when the skin is still trying to heal and get back to its original state. So personally, I always tell my patients to wait at least 3 months postpartum before going back into doing any sort of crazy procedures like chemical peels, microneedling. Now, laser hair removal is different on the other hand because a lot of my patients might have PCOS, and so they want to get a jump on the hair, which I understand. But for chemical peels, microneedling, and other laser treatments, I would say wait till at least 3 months postpartum before you go in and do any procedures. Now, that's me personally. Some other skin experts or dermatologists might disagree, but that's how I practice in my office. All right, so I hope that's helpful for you.